So the first question, what do you consider to be the most important technological advancement in healthcare delivery and financing in Nigeria over the past years?
First of all, I think health insurance. That for me has been one big leap in Nigeria, and I'm sure a lot of people are thankful for that, especially those that are in the public sector, those that couldn't really afford private healthcare. They now have access to the private institutions. Secondly, when you talk about advancements in technology, I think it's important that we divide that into two. First, the private hospitals and the public. Now, with the private hospitals, wearing my Microsoft hat, we found that quite a few hospitals now have electronic patient records, EMR. That is one avenue that I feel that a lot of private hospitals they're taking advantage of that right now. Another one is the cross-border synchronization of patient information for ease of healthcare information. That is where you find hospitals in India, for instance, having some satellite hospitals in Nigeria, where they take care of post-op and pre-op sometimes. Of course, they do that for capital flights, where they take care of them here, and then when it comes to anything, they just fly them out of the country. It is a technological advancement as well. The other is I call it, you see that a lot of hospitals now have capability for diagnostic equipment. They have very advanced diagnostic equipment. What we found is, I'll give an example. There's certain hospitals in Nigeria right now that they have these 64 slice machines or 32. Sorry, I'm not a doctor, but I've interfaced with quite a few doctors. But the problem is, do the doctors know how to read these records? They can't. So for me, I find out that there's been a leap in the type of machinery that we're bringing in, but with the educational part of it is not going at the same pace. So when I heard the other panelists say that we need more education, I don't just think it's in management. I think it's also in being able to read those. No, I laugh about that. No, seriously, we should be able to read those reports that we get from the technology. So another thing that I would like to focus on is when we talk about technology, a lot of doctors and a lot of clinicians say it is expensive to deploy technology in the clinician space. And I say to them, look, we're now in a mobile first, cloud first world. And what does that mean? You don't need to deploy hardware anymore. You can store things in the cloud. You can have a database of patients in the cloud. There are a lot of providers that are there to kind of enable us to do this. Just double clicking on this, with Microsoft, what we're trying to do right now is we're trying to talk to the public sector officials, and I think this needs to start at the state level. Mr. Commissioner, so I'm not, we, at the state level, I believe, at the state level, I believe that we need to deploy a medical record system that is common to all. Why do I say this? Somebody goes to Badagry, for instance, from Ikeja. They need to start doing everything from scratch. X-ray, blood tests. What this does is it's taking a lot of money from the system. Why can't we just have one single record system across board? So that no matter where you move from in the States, you still have access to your medical records. And then once we've done that in the States, they can now harmonize this federally. I feel that is the future. So I'm just answering how can we enable technology, reduce the costs of healthcare delivery. Thank you.
That application actually exists. I'm privy to software that has been designed to take care of that problem. And this is one of the innovations that's coming out of the industry. Of course, there are a lot of bureaucratic issues as to statewide implementation on public sector and private sector, as the case may be. But yes, I will say that people are thinking in that direction and work has been done in that respect. Mrs. Adevaki, please tell us what, in your own opinion, are the advancements that you've seen in the healthcare sector over the last 5-10 years?
My name is Abimbola Adebaki. I'm Chief Operating Officer for Tony Elumelu Foundation. And I'll just give you a quick background so that you can see the context where I'm approaching the technological advancement from. One of the things we've done in the past 2 years is to set up a program that cuts across boundaries and at a scale that people thought was not possible just a few years ago. We have committed $100 million to identify, to train, to build up 1,000 entrepreneurs every year for 10 years across all sectors. So we're sector agnostic and it cuts across all ages, and they are everywhere in Africa. What we have done seems very simple to explain in a nutshell. However, we have utilized technology in a very simple format to cut across boundaries. And we're seeing increasingly that sectors are adopting technology to cut boundaries. We know that the health sector is a late adopter, but it is adopting technology from SMS, a simple technology, to reduce infant mortality and maternal, to improve child care. We have Tony Elumelu entrepreneurs who are now setting up online platforms for increasing knowledge and understanding of child provider, care providers, caregivers, families themselves. So for us, what we think is happening is that we're leveraging technology that is very well, it has penetrated other sectors, like the financial services sector, and we're transporting it into entrepreneurship development. So one of the things we urge in the healthcare sector is that you see other sectors and how they are adopting technology, and you translate that into healthcare provision all across the value chain. I happen to have a background in the healthcare sector myself, but what I have seen is that we're still trying to do things that we shouldn't start from scratch. We should leapfrog based on the fact that it is available in other sectors. And I'll give you a few examples of what people are doing now. So we've had mobile for since 1999 September, then 2000, and it's been shooting up until now. But it is only recently that we're beginning to use mobile for electronic records management. You go to a seminar, a typical large-scale seminar, and you get there and you're able to share your information with someone else at the touch of a device, your device with the person's device, and immediately you've uploaded documents, videos, and so on of yourself. How are we able to use that in healthcare records? How are we able to cross boundaries that typically exist, physical boundaries that ought not to be a deterrent in Nigeria? That is what we're saying is coming up now. Now, another thing that has come up is the online delivery systems, especially to boost universal access. We have no excuse any longer to say that those in the rural, in the rural side of Nigeria should not access basic health care. The excuse was tenable 10 years ago. It isn't tenable any longer. If they're able to have mobile phones to call their folks in town, they should have access to some care that comes to them through mobile phones, and even now through wireless technology, because you can set up hubs in the villages using solar panels, using internet through wireless devices, and they can access it. Coca-Cola took on that statement that Peter showed earlier that said, how is it that we're having challenges with drug delivery when Coca-Cola can reach every nook and cranny? And they have now flipped it over to take themselves further, to create youth entrepreneurship hubs in remote areas where they are deploying this technology of batteries, solar, and so on. We think that healthcare sector should also begin to adopt that and not see the challenges, but to adopt technology that is used in other sectors in healthcare. I'm rambling a bit, but the point is that the Total Entrepreneurship Program that we've deployed has used technology to cut across Africa at a scale that we're hoping to share with the health sector to do the same for care delivery, and also later on I'll be talking about for enhancing business tactics amongst healthcare providers, because we see a clear gap there, and we think that's where we should adopt technology further.
My name is Femi with the Airtel network. Basically, we're a partner with PharmAccess, and one of the driving force behind that is we see healthcare and education as two things we need to impact our community with. And our healthcare program, Airtel Touching Lives, actually goes beyond the urban area into the rural area. Looking at technology we have as telcos, not limiting to Airtel, though I'm here based on the platform of Airtel, is that the technology, the mobile technology can help all forms of innovation. Whatever you're doing, you can digitize it. So we look at innovation from product innovation point of view, process innovation, even organizational innovation like Dr. Adeyemi of Crystal mentioned, having to take his organization through some productivity innovation process, and marketing innovation. So, and in terms of the low end or the rural side where there is some big gap on quality healthcare delivery, we do have modes of reaching out, and I give an example of a product Airtel launched in conjunction with a company called Micro Insure. It's called Airtel Insure. So basically, once people make calls or browse, do transactions on their mobile line, they accumulate points. So it was a loyalty program we did, whereby we were able to between November 2014 and March 2015, the figure I have, we had about 1.6 million customers on the Airtel Insure program, and they were entitled to hospital claims and life insurance claims. So you could, from that, companies could come up with loyalty programs whereby people get health packages in return as a reward for patronizing them. There are several things around that. I also give an example of what Access Bank is currently doing with Cardinal State Government. I think this is being funded in conjunction with EFINA. It's called Better Mama, Better Pikin. So basically, insurance, people pay 100 naira, they get to save 100 naira every month, and they have access to primary and secondary healthcare. And that has reduced the infant mortality rate there. So I think the access person is in this session, so you could engage informally. But what we're trying to say is that as telcos in Nigeria, we're open to working with healthcare delivery partners in product innovation. I mean, for example, we see now you can authenticate drugs by sending an SMS to a short code. That is very, very vital in Nigeria based on the incidence of fake drugs. So product innovation, process innovation, setting up your data centers, setting up CUGs, marketing innovation. Healthcare needs marketing. So it's not enough that the government will bring up a policy, but we must be able to reach out also, create brands that people want to associate with. So I think we would like afterwards, for partners here, should feel free to approach us with your ideas, whether fully baked or not, and we will sit together to make something good out of it. Thank you.
Thank you. I think this is an excellent opportunity to ask this next question, which I will direct back to Mrs. Adebaki. Of all the companies in Nigeria, or the institutions in Nigeria, I would assume that you've worked with a couple of them in your quest to fulfill the objectives of the foundation. Which of these organizations or which of these companies do you consider to be the pioneers in the use of technology as it affects the healthcare sector? one, maybe two, maybe three. I will also be throwing this to the audience because there are perhaps companies that are here that are doing something in healthcare specific to the use of technology that we would like to know what they're doing here. But I would like our own perspective from working from the foundation angle.
Within the group, because Tony Elumelu Foundation is within the Heirs Holding Group, we have A1 HMO that utilizes a lot of technology in both delivery and in prevention of diseases, right? So you all know the business of the HMO. If you are able to reduce, incidents of illness, you are more likely able to improve your margins. And A1 HMO is leading in that space. Now we're taking the mindset of A1 HMO down to those who are. I brought a couple of Tony Elumelu entrepreneurs here. One of them is into mobile dentistry. And what she does is she takes the dentist to the user, and she's begun to do this with schools, with offices, and so we're reducing the barrier of access by making it more convenient and more affordable. And she's even doing that even for the indigent, because she's got plans to get sponsorship to now take the same level of care, the kind of quality that you get in a private school. She's taking it to the public school so that they can access it. She's using technology. Technology is beyond the devices, but actually using processes, knowledge, and then the devices to deliver. We have someone also who uses. He's got a patent on a handheld device to detect cancer, and he's winning so many awards all around. But he's also a Tony Elumelu entrepreneur. He's in Abuja, so could not come for this particular session. Now, I know you haven't asked me this, but I'd like to add. These entrepreneurs are sticking their necks out there in our sector, the healthcare sector. And I say our because I trained as a pharmacist initially, though I have turned good. Now, they're sticking their necks out there, and many of you are also doing the same. They are the ones that are bringing technology into practice, and we need to support them as much as possible. It's not enough to give them funding. In fact, we say the fund is the last thing, because our program is not a grant seekers program. We think there are certain things that need to be put in place beyond the enabling environment that you can begin to talk about government.